This year, nearly 13 million kids in this country will require medical care because of preventable injuries. Accidents are the single most common cause of death among children under 14 years. This story is not a recreation. It's a look inside Children's National Medical Center in Washington, D.C., where trauma teams wage a daily battle to reverse these tragic statistics.
You never know what could be coming. Is this something that's going to be just a scrape, or is it going to be a child who's going to die the minute it rolls in the door?
911.
Yes, I have an emergency. My son just got burnt with grease.
Where, on what part of his body?
His head, his shoulders.
Word of the incoming patient is relayed to a trauma team at Children's Hospital.
One trauma stat burn, ETA, 10 minutes by helicopter, emergency.
When you're transporting children, your emotional state is higher because you know this particular child, in this case, has so much life ahead of him. You just realize how easy it could happen to your own children.
Hey.
I'm here.
This is a 2.5-year-old.
2.5-year-old Christopher was accompanied on the 80-mile flight to the hospital by his father, Tommy Trosbach.
I was cooking dinner with a deep fryer, and the cord was dangling low. I heard him say, "I want to see," and before I could even turn, it was on him. It was hard to be separated.
Okay, sweetie pie. He's got some burns on his forehead, over his left ear.
Christopher's put on morphine and examined by Chief Surgical Resident Ann Mangtolo.
Anybody who's burnt their finger knows that a burn is painful. And Christopher had about a 15% burn, so we knew he was hurting.
Yeah, 66 rings, please. It's right down the bed. There's two of them over there.
The trauma team is headed by Dr. Marty Eichelberger.
This is where you have to control your emotions. You have to be able to do the right thing for this child. We know that if we don't do it, there's no question the child will go on to die.
Go find Mommy and Daddy.
Chris?
Mama, Daddy.
Yeah, we'll go.
It's important that his burns are covered up, but it's also important to try and get him calmed down, because with burns, they're going to go through a prolonged period of having dressings and having painful things done to them.
We've almost finished. We've almost finished. Almost done, huh? Almost finished. Okay, buddy. You're okay, sweetie pie.
Okay. It's going to be a little while before we're going to be able to tell you how bad these burns are and whether they're going to need any skin grafting or anything like that. But that's something that we'll learn over the next day or so. I'm going to take you back there in a moment so that he can see you and so he can calm down a little bit.
Daddy's coming.
Yes, Larry.
Look, Daddy. Look. There you go. You can touch it. I won't touch.
There you go. You give Daddy a hug there. All right.
Clinical burn nurse Donna Gordon takes over Christopher's care.
It is quite an ordeal for a 2.5-year-old. It's quite an ordeal for anyone.
Dad, what we're going to do, we're going to take him back to the treatment room, to the tub room. We're going to shave his hair, then we're going to wash his wounds and remove all the blisters. We do ask that you remain out here while we do this.
We don't want the child to associate the pain with the parents. So when he is finished in that tub room, he can go back to the loving, supporting family that he's always had.
And we're going to go down to the tub room, okay? It's going to tickle a little bit, honey. Okay? We have to take and shave all the area to see exactly where the burn is. And that way we'll be able to take and apply the medication after we remove all the blistered areas.
Gave him a little something to sleep, huh?
The problem with burns is that you never can really tell the depth of it right at the beginning, especially with grease. The children at his age have very thin skin, so it doesn't have to be that hot for you to sustain a full thickness burn. It looks to me like it's a deep second degree, which is, it's not just the superficial part of the skin, but it's a little bit deeper. What we will do over the next 4 or 5 days is let the burn declare itself as to what the depth is, and then we will decide whether or not he requires any grafting.
We're done?
Yeah, we're done. We're done. We're done there, my friend. You're doing great. Just relax now.
Mommy's here.
Mama!
Yeah, Mommy's here. Mommy's here.
After more than 2 hours of driving to get to the hospital, Christopher's mother, Carrie, finally gets to see her son.
Say hi, Mommy. Hi, Daddy. Here we go.
It was devastating to see your child like that, to know the pain that he is going through. You feel responsible for every act and anything your child does, and when something like this happens, you just have nothing else but to feel guilty. It is the worst thing a parent can ever go through.
You're doing fantastic. You're such a good boy. You were very, very good. You know that?
That same weekend, a helicopter arrives with 2-year-old Ebony Clark and her mother, Kelly.
This was a child who had ingested 10 to 20 cc's of lamp oil. My main concern was that she may have ingested this lamp oil and aspirated it into her lungs.
She was gagging and coughing, and she couldn't catch her breath. I was really scared.
I know you want Mommy.
The most important thing with the poisoning is that she be able to breathe, because some of the poisons that they take will actually stop your breathing and stop your heart.
Okay, Ebony, it's okay. It's okay.
And if the child is alert and combative, those are good signs, because we know that the child is at least responsive.
She needs a chest x-ray and she can go to room 8 real quick.
Just a second.
She has a history of asthma. She's on no medications, no hospitalizations, no allergies.
Ebony, we're almost done. We're almost done.
You just talk very calmly. If they sense fear in your voice, they will be afraid also.
Yeah, honey, we're sorry. Okay, just rest your head. There. That's
Keep
nice
your
and
bear
cool.
Keep Bear there. He wants to stay with you because he's scared.
We can redraw.
Okay, he's scared too. Okay, you gotta protect him. Okay?
Mom's
and then
coming.
when Mommy comes, you tell her everything that happened, okay?
She's doing very well, and we're going to keep her in the hospital for a day or 2. We still are waiting on a chest x-ray, but for her to get a fatal dose, she would have had to have consumed, much more than she did, so.
She's gonna go in.
Imagine she's going to be okay. It's pretty scary, but she's going to be okay.
Get you back there.
Hey, Mom. Ebony.
Mom and Grandma.
Hey, Ebony.
Okay.
Come on. Hi, Ebony. She's doing good. She's really good. Mom. Why don't you just come over here? Who's Mom?
This is Grandma. Grandma. Okay,
Why don't you just come over here? She's real
It's okay.
When children go through trauma, they need a lot of emotional support, and they can best get that through somebody that they love and know, and that's usually their parents. So we try to unite them as soon as possible.
You can talk to me? She's not mad at you. She's not.
Here, why don't you hold it? Just hold it towards her face, okay?
Look, there's Grandma, too. Yes.
Mom, baby. Hi. Uh-oh, Mom made you angry?
Oh, look at that.
I thought my grandbaby is going to be fine. I just wanted to just hold her and just kiss her and just say, it's going to be all right, I was never so relieved of anything, I think, in my whole life.
The day after Christopher was burned, it's still too early to determine if he'll need to undergo skin grafts.
Christopher was very scared. He doesn't know why they have to unwrap him and hurt him. He doesn't understand that they're trying to make him better. But he knows that Tommy and I will do everything we can to try to soothe the pain.
Yeah, we don't quite got over the shock yet. Everything's changed 100% in a short amount of time.
When Ebony Clark is released after one day without any lasting injuries, her mother thoroughly child-proofs their home.
We learned that you can't do enough to watch them, but you can go through, as we did, and take another look at everything that you have around to make sure there's nothing like that can happen again.
It's been 6 months since Christopher Trosbach was burned. Though his burns are healing well enough that he won't require skin grafts, he continues to undergo treatment.
He definitely knows not to go around the stove while I'm cooking now. That's something that it's so hard to express to a child because they just do not realize the pain and what can happen if they get too close to a stove.
Can you take them off?
Yeah. We're not quite sure what amount of scars he's still going to have. As long as you keep it moist and keep the skin stretched, it will slowly fade more and more.
Want to go outside and see the puppies? Yeah? Want to play with the puppies outside? Yeah?
The leading causes of death in childhood today are preventable injuries. You have to put the seat belt on the child. You have to protect that child's environment so that they don't sustain a burn. We as a society have to reduce this unacceptable epidemic, and that's the whole reason that the Safe Kids campaign has come about.
Want to hold the puppy? Be real careful.
It could have been a lot worse. We were lucky.
We kiss his puppy?
I just like to thank everybody in the hospital because all of them did so much. They helped us deal with our emotions, and that helps a lot.
Little puppy loves you.
Since the accident, we have learned that he is very precious and can be just taken away in a heartbeat. So we all just tried to be together more as a family.
How many puppies we got? 9. Hold this hand out, too.
He's my only child. I mean, what can you say?
4 of these fingers. 9 puppies. You know, hold this thumb in.
I don't think there could be another.